All right, we're back in session, and we'll go ahead and have you introduce yourselves, and we're meeting with the Southeastern Idaho Public Health and talk about our budget request.
Okay, thank you. So I'm Maggie Mann.
I'm Tyler Butler.
Okay.
We brought Ken along. He's a newer department manager with us, and much like we brought Allison last year, just wanting to see the process.
Okay.
So we'll just go ahead and get started. So on the first page of your handout is information about our budget hearing, which will be happening in May as part of our regularly scheduled Board of Health meeting. That will be on Thursday, May 18th at 9:30 a.m. at our Pocatello building. So what I'm sharing with you today is what our board reviewed last Thursday, the 13th, and by a majority vote recommended us to bring around to the county commissioners. So that's what we're sharing for you. It's our proposed budget that would begin on July 1st, which is the start of our fiscal year, and would run through June 30th of 2024. So in your handout, the very first page is just the language pulled from the statute of House Bill 316, which changed the public health districting law to remove the state general fund appropriation. And so we're still sort of dealing with the implementation and fallout from that, but that's just there as a reference and a reminder for you all. Page 2 takes a look at our proposed fiscal year 2024 budget composition. So you can see the majority or the largest chunk of our funding comes from subgrants and contracts that make up 55.9% of our overall funding. Our counties make up our second largest portion at 25.6% in the blue. Fees for service is our third largest funding source at 16.9% in the gray. And then we are receiving funding to address the opioid crisis. And so we have received funds up front from a number of settlements. And so we're drawing down on those funds. We can't use them all at once. And we also have very specific things that we are allowed to use them for. And so that, but it's a sizable amount, so that makes up about 1.5% of our proposed budget. On page 3, this is the detail of House Bill 316 that was passed in 2021 by the state legislature, and its impact on the county fiscal year for 2024. Okay, so this page, we're talking totally about the county fiscal year. The first line, additional county aid, House Bill 316 stipulated that the additional county aid needed to remain at the fiscal year 21 state appropriation level. That dollar amount was $1,142,300. We are not receiving a state general fund appropriation in fiscal year 2024. And so the shift to county aid during fiscal year 2024 is $1,142,300. So that's the amount of the additional county aid. Any questions about that?
Additional county aid.
Yes, additional county aid because of House Bill 316. And as we walk through this, please, if you have questions, just ask me. I'm happy to try and answer them. So page 4 is a summary of the county contribution changes based on SIF, or Southeastern Idaho Public Health's fiscal year. So the first part of the page details our current budget for fiscal year 2023. So the county pledge, the combined 8 county pledge to the public health district for the current fiscal year is $1,227,796. There is no adjustment for the fiscal year timing difference for this portion. And then there is additional county aid shifted from the state in the dollar amount of $1,130,612. So the total budget for this current year from the counties is $2,358,408. So when we look at changes, we are not requesting an increase from the counties. We are allowed to request up to a 3% increase from our counties. Again, this year we are asking for level funding on county aid. As a result, there's no adjustment for the fiscal year timing difference on the original county aid or on the additional county aid. There is an adjustment of $11,688 as an adjustment for the fiscal year timing difference on the additional county aid. So for the fiscal year 2024 budget, the total county request is $2,370,096, and we'll get into what that means for each county on page 5. So Commissioner Huff and Commissioner Moser, this probably looks familiar to you. Commissioner Crowder, the county aid, as we talked about when you came up to our office a couple of weeks ago, the formula for this is set in Idaho code, and that code reference is at the top of the page. So there are two components. There's population, and we look at a county's population as a percentage of our overall county population. And then we look, and that's 70% of the distribution formula. Then we look at assessed market value, which is 30% of the formula. And again, we look at that as a percentage of the overall assessed market value for our 8-county region. So we'll start on the table in the top half of the page, and we'll work left to right. Starting in the green columns, those are the population numbers. So the most recent census data that we have is from 2022, and it shows Bannock County's population as 89,517 people. That is 48.6% of our total district population. So the dollar amount requested based on population is $418,120. As we shift into the purple, that's the assessed market value. So the valuation for 2022, which is the most recent year that we have data for, that's 44.8% of our overall assessed market value. So the dollar amount contributed based on assessed market value is $164,898 for a total original county aid request in the light blue column 7 of $583,018. That is 47.5% of our total county aid, and it is a 0.3% change or increase over what you are contributing this year. So even though we're asking for level funding, it impacts our counties differently because of changes in population and assessed market value. So as we move down to the bottom table on the page, that shows you why that change occurred. So column 1 in the white on the left shows your contribution of original county aid for this current fiscal year. That's $581,448. You actually have a decrease based on fluctuations in population of $1,738. But then in column 3 in the purple, you have an increase of $3,308 based on changes to assessed market value. Again, we're asking for level funding so that when you net those changes in columns 2 and 3, that's a total increase of $1,570 in original county aid for a total original county aid request of the $583.18.
While you're there,
Yes.
the assessed market value that this is assessed at is 2022.
Correct.
So
December 2022.
December 2022. Yeah, that's the most recent that we have.
yeah.
So on the next page, this gives you a little bit more detail. So we'll again start at the table on the top half of the page, looking at population in blue and market value in green. This takes a look at each of our counties and the changes in population, both the hard number as well as the percent increase. So you can see Bannock County increased by 1,254 people, which is a 1.4% increase. Our county that had the biggest percentage increase was Franklin County at 3.6%. Butte and Caribou County had the smallest percentage increases at 1.1% for an overall district population growth of 1.8%. When we look at assessed market value, Bear Lake had a big jump, an increase of 47.4% of their assessed market value, but really most of our counties had double-digit increases. The only one that didn't was Butte County at 9.4%. For a total overall district increase of assessed market value at 32.9%. So the table at the bottom is just for your reference. This lists out the 7 public health districts that we work collaboratively with. And it shows that the biggest percentage increase in population occurred in District 3 based out of Caldwell. The smallest percentage increase occurred in Districts 4 and 5 at 1.4%. Market value, Tyler actually double-checked and triple-checked this number. District 1, based out of Coeur d'Alene, their total district change in assessed market value was an increase of 65.2%. I don't ever remember an increase in a district that sizable ever. But every district had pretty significant increases in assessed market value, which I'm sure is no surprise to all of you. Any questions about that? Okay, so on page 7, now we'll dive in and look at the additional county aid, which is that was mandated by House Bill 316. So it's also run through the 70-30 formula, 70% on population, 30% on assessed market value. So we have those same numbers and percentages. So the total additional county aid request for Bannock County is $542,420. Again, with this county aid piece, you had a reduction based on population, an increase of just over $3,000 because of assessed market value swings, for a total change of $1,461. So the total request for the additional county aid is $542,420. On the next page, we do a couple of things. We combine the original county aid, the prior state aid, which is, again, the result of House Bill 16, in the top table. So looking at that, the total request of Bannock County is $1,125,438. That is 47.5% of what we're asking of our counties overall and 12.3% of our total budget. So this table on the bottom specifies our fiscal year, which is July 1 to June 30th, and the county fiscal year, which is October 1 to September 30th. So you can see exactly what this request would mean for the county for your coming fiscal year. It's an increase each quarter beginning in October of $757.75 per quarter. Okay. So then the next page, page 9, is a summary of our total budget. So I'll explain the columns and then I'll start at the top of the page and work our way down. Column 1 is our current year adjusted budget. Our Board of Health has reviewed budget adjustments, I believe, twice in this fiscal year, and that's largely because we have had streams of funding that have changed. For one example is the opioid settlement dollars. We got significantly more money fronted to us than we had anticipated, and so we needed to account for that. That's one example. Column 2 is the original current year fiscal budget. Column 3 in the yellow is what we're proposing for the coming fiscal year. Then column 4 is the number change, and column 5 is the percentage change. So again, we'll start at the top with our FTEs, or full-time equivalent employees. So we are projecting an increase of 1.53 FTEs. That's an increase of 1.7%. So there are a number of things that are causing that change. We do have a new subgrant that will start July 1st. That's coming from the federal level to the Department of Health and Welfare, and they received spending authority from the legislature on this. It's to address public health infrastructure needs. And that is going to fully fund 4 new positions for us. So we're putting a new environmental health specialist in Ken's shop. We're increasing our epidemiology staff. We are hoping to hire a grant writer and then a data analyst who can help with quality improvement projects and that sort of thing. But then we also have some decreases. Some of our COVID positions are going away. We have had some staff request reduction in hours. I think we have one nurse who requested a small reduction in hours and a couple of WIC staff. So when we net all those changes together, it's an increase of 1.53 FTEs or 1.7%. So when we look at expenditures, we are projecting that they will go up 1.4%, a total of $128,819. Our largest expenditure category is personnel, and we are projecting an increase of 6.2% or $434,369. That's largely based on the salaries of those 4 new employees that will be fully funded by that public health infrastructure grant. It also includes change in employee compensation for the coming fiscal year, and we proposed a 4% merit pool that is based on an individual's most recent performance evaluation. Operating, we're projecting a decrease of 12.2%. That's due to a number of things. Again, COVID expenditures going down is making up a sizable amount of that. We've had some changes to our public health preparedness program and have shifted our healthcare coalition. It's no longer under our direction, but instead at Fort Neff Medical Center. And as that transitioned to the hospital, we had to make some changes in how that coalition was doing spending. And at the hospital's request, we took on some of those operating expenses this fiscal year, but they will fully take those over for the next fiscal year. We are not at this time projecting any capital outlay expenses. We are in the process at the recommendation of a couple of our counties of migrating our auto fleet from purchased vehicles to leased vehicles. That has been a really great change for us, but as a result, typically in the past we had budgeted for 1 or 2 vehicles to come out of capital outlay, and we don't have to do that anymore because we're just paying the lease costs instead. And that's been a really good change. Moving down to revenue, we are projecting a 1% increase in our revenue of $88,928. So that includes a 0.5% increase from the counties of $11,688. Again, you can see for Bannock County, that's a 0.3%, a total dollar amount of $3,031. We are projecting our contracts or subgrants to go up slightly at 0.4% and our fees to go up 3.6%. We do have a new line item on our budget summary of the opioid settlement drawdown. We're anticipating that we will use $140,092 of the funds that were upfronted to us in this fiscal year. And so we do not project the need to use any of our district reserve funds. Our board's policy has been to maintain a minimum of 3 months of operating reserve in case we have some kind of emergency. And so there have been times in the past where we've had to pull on those reserves to balance our budget. We don't have to do that this year. So any questions about that?
Comments?
Yeah, on your revenue for your fees and miscellaneous, when was the last time you guys adjusted your fees for your inspections and those type of things?
So our fees are set on a calendar year, and so our board reviews data that our department manager shares at their December meeting, and they approve those fees every December. And so for the current calendar year, they were reviewed and set in December of 2022.
And then what's your process for that, setting those? Are you comparing against other counties? You just saying last year plus 1 or 2%, or?
So Ken, in Ken's department, and I don't want to speak for you, so jump in here if you want, but he takes a look at a 3-year rolling average of what our costs were compared to the number of services that we provided and comes up with a cost per service. And so that's how his fees are set. He does do some talking with other public health districts, in particular District 7 to the north and 5 to the west, because we share some borders, and so we don't want to be completely out of whack. Again, our costs vary too. We are very lean, and a couple of years ago we had a number of people who had been in that department for like a really long time, so they were at higher pay. We have newer staff right now with a couple of exceptions, so our costs have come down a little bit. So anything you want to add?
Yeah, so most recently the septic permit went down, and that was due to the large volume of septic applications that we received. It's kind of the more we get, the lower the cost will end up coming. So that fee actually went from $800 to $712. You know, that could totally change next year. Like we're District 7, they were a little bit below us, but now I think they're at $800, which is where we were before. So still somewhat close, but yeah, that one can go up and down.
And we can't charge more than our actual cost, so that's why we base that cost on that rolling 3-year average.
And then the food fees are set in Idaho code,
Yeah.
so we can't change those. Same with the pool, swimming
Yep.
pools, some programs like that.
Okay.
So do your fees cover the entire cost of the septic inspection program?
So
That's the goal.
That's the goal. That covers 100%.
Okay. What about restaurant inspections?
Yeah, that does not
No.
cover it. We figure maybe half or a little bit less.
45%.
45%.
What is the fee for restaurant inspections?
For your typical restaurants, $200. A mobile food establishment is $80, or a grocery store is $250. There's also temporary, like a temporary food vendor that's doing like 4 days or more throughout the year is $80. And those are set in Idaho code. At this
Those
point,
fees are set in Idaho code?
Yes.
yeah, they're still
Okay.
out.
So the fees are set, but the actual cost is double what the fees are?
Yeah.
So that's been an issue of some contention for a long time, like 30 years. And for a long time, there was a 3-legged stool approach, which was a third borne of the cost borne by the counties, a third by the state, a third by industry. But that's changed now because the state's no longer involved. So we were able to negotiate a change in the food fees, I think about 4 years ago. That was phased in. The first increase went in, I think, in 2021 or 2020.
2021, 22. And then we've been in with the max
Right.
of that fee for about a year. So it was a 3-year phase in to get where we're at right now at 200. And I can't remember where it started, but I think before the last change was $160 for a brick and mortar food establishment.
It's really challenging to get those food fees changed in code because the hospitality industry does not want them to go up. When you compare us to states around our region, we are significantly lower than any state in our region.
We're significantly lower than what we charge? What statute is this that deals with this?
I can keep that for you.
Yeah, I don't know the code reference right off the top of my head. Do you? Yeah, I don't know, but we could get it for you.
Yeah, I'd like to see that.
So Your department, Ken, is the one that does both the inspections for the food and the septic, correct?
Yeah, we do food, septic systems, land development, landfills, childcare. That's more of that's a sub-grant through Idaho Department of Health and Welfare, and then we have a contract with DEQ for public water systems.
Did you say public swimming pools?
Yeah, public swimming pools, that fee's also set in code, Idaho code.
And so for the septic fees, when it says you can only charge what that cost is, are you basing your cost on like what the whole department cost is, or just the cost of you to drive out there and take a look at it?
So when we receive a septic application, once we get that application, whatever time we put towards that permit or in that whole septic program, we'll code our time to that, so it tracks our time, which then we get a cost from that based on the number of applications we get.
So inspection time and administration time and everything.
Administration time, and that's what goes into that is the processing the application, driving to the site, doing the on-site evaluation of the property. We have them dig test holes. We collect soil samples. We work up that soil to determine soil type. There's that issue from there. And in between this, there is typically, in most cases, significant consultation with installers, property owners. And then once we issue that permit, we then go back and inspect the septic system. And along with that process, if there's any issues with the installation, there's then follow-up with the installers, the property owner, whoever installs it. So sometimes that goes smoothly, and sometimes there's follow-ups, rechecks and things like that.
So you have food inspections, you have septic inspections, and you have other inspections you do for which fees are charged?
Yeah. The other fee, swimming pools, public swimming pools. That fee is
Just
$50.
public or private? Just public,
Just
right?
public.
Just public.
Right.
That fee is $50, but that does not come close to covering the cost of that program either. But that fee is also set in Idaho code. We can get you that code as well.
And that fee has not been changed in over 25 years.
Do you know what the percentage is that's covered?
When I looked at that, I think it was, I hope I don't get this wrong, it was around $350 was the cost, but we're charging $50.
Okay. And what else?
Fee-wise, land development, so someone proposing a subdivision in the county where septic will be used. That process, the review of the subdivision is similar to the on-site septic program where test holes. Difference would be we're working very closely with engineers, a lot of consultation back and forth with the developer and engineers on the project. So with land development fee, what other fees do we have? I think that's it.
That's it.
Yeah. Oh, there are several other fees.
Septic pumpers,
Septic
installers.
tank pumpers and septic system installers.
You said something about childcare, I think.
Yeah, that's through sub-grant with Idaho Department of Health and Welfare.
That's completely paid for through these sub-grants?
Yeah, that's paid through.
Um,
Same with our public water system, that is paid for
Okay.
through DEQ.
On this subdivision thing that you were just talking about, is that completely covered by the fees, or is that also?
That's similar, we calculate that fee the same way we do the on-site septic program. Number of lots, it's based on number of lots.
Right.
That fee is currently $75. It was $70 last year, and it went up $5 to $75.
And that covers the cost of that program?
Yeah.
So it's just
And
like the
when we look at
septic?
that too, we kind of look at the trend of where we were 3 years ago.
Right.
Where numbers increasing, does it look like they're going to continue to increase? That we use that to help
Okay.
determine the budget.
And then the funds that the counties give you, does that go towards specific programs, or does that just go into your general fund for use however?
Do you want to take that one?
Sure. So it's a combination. There are programs like they mentioned, the food fee program, where we have the fee set in code, but it doesn't cover the cost, so it goes toward that. There are some programs that fees or grants don't fully cover, so it supports those programs. And then also supports our indirect staff, so like fiscal, HR, IT, director.
And then cover a little bit about our reserves and the buy-down possibility that was talked about, and then the conversation that we had last week about funding, how the funds are going to go, and Robert made that motion.
Oh, sure. So specifically the county fund drawdown piece. So probably, let's see, we're fiscal year, the end of fiscal year 2021, we have a surplus that's atypical for us, largely from COVID funds coming in. So the board committed $405,000 from that surplus to a county fund drawdown committed fund category. The end of this last fiscal year, they committed an additional $146,000, I believe. And so that county fund drawdown is a category that the board can use to draw down our reserves from that line item and decrease the amount of the county contribution. That was presented to the board, and the board discussed utilizing that in years where you guys have more challenges with your budgets across the counties. And you all would know when that happens more than I would, but that was what the board discussed. Did that cover what you wanted?
Yeah, but the following years, that'll be utilized.
Yes.
Set a cap on how much money's in there and utilize them funds to draw down from now on.
They voted on that and agreed to that?
They voted to commit those funds, and then in any year that the collective group decides to use those to draw down, they're committed to that category, and it's able to be used as a drawdown. I presented in the budget what it would look like in increments of $50,000 on what how the distribution or funding formula would change based on that, and the discussion among the board was that the counties aren't, this year wasn't like a hurting year like some of the years that you guys have experienced in the past. I don't know the insight to all of that, but that's what they discussed.
But put a cap on it, basically, is what we did as a board. Raising that because the $140,000 next year will be put towards drawdown.
Well, the annual contribution to that designated fund or that restricted fund is based on if we have a surplus at the end of a year.
Yes.
And so the percentage of the county contribution in the fiscal year, we take that from what might be remaining and dedicate it to that fund.
Yes.
Yeah.
Yes. Other questions?
Is there more to your presentation, or was that the whole thing?
I think Commissioner Moser, you are the chairman, correct?
Correct.
So there was also, at the same time that House Bill 316 occurred, there was a change in our budget hearing process that required that the chairman of each of the county and the public health district be the ones to vote at our budget hearing, or the chairman may designate a proxy. But because Commissioner Moser is your chairman and is your Board of Health rep, then you don't need to worry about a proxy. But all commissioners are welcome to come to the budget hearing. Again, the information is on the front page, and so the last couple of pages are just some information on all of our services, the language in code about that budget hearing change, and then the proxy form, which you all don't need.
So this second to the last page here, where it says public health programs,
Yes.
is this all the programs that you guys are involved with, or are there others that aren't on this list?
This is, let me just look. I think this is pretty up to date. I will say our diabetes and heart disease program is going away. That funding was cut at a federal level, so as of June 30th, we will no longer have that program. And so is adolescent pregnancy prevention. We currently only teach that at the middle school and high school at Fort Hall, but that funding is going away, actually being redirected to the State Department of Education. So that will no longer be something that we offer. Let me just look. And there are more environmental health programs. This is, yeah, but, and what did you say, Tyler?
MOUD.
Oh, yes. And then medication for opioid use disorder is something that we've started in the last year because, and Chantal can attest to this, that's a really dire need in all 8 of our counties, and Bannock County in particular. And so we have 2 nurse practitioners who've become certified to be able to offer treatment for people who are using opioids in unhealthy ways. And so that's not on here either.
What is the name of that program?
Medication for opioid use disorder. And I believe we are hiring a counselor. I don't have the confirmation yet. That's been about a 6-month process because they just are not in steady supply in our state and in our area. So we're very excited, hoping this individual accepts our offer and can start then shortly. So that will be great because all of the research shows that the clinical piece, when combined with the cognitive behavioral therapy piece, is when people are most successful at kicking the habit of using opioids in an unhealthy way. So we've been missing the cognitive piece. So we're pretty excited to be able to hire a counselor. And the opioid funds, the opioid settlement funds, are paying for that position in full.
Are all the programs you list on here statutorily required?
Well, that's an interesting question. So the public health districting law talks about the public health districts being mandated to provide, and I don't have the exact language off the top of my head, but environmental services, physical health services, health education, and there's one other thing that I'm missing. So it's stated very broadly, but everything on here falls under that statutory mandate.
But some of these things you said are going away,
Yes.
and that's because they're federally funded and the federal funding no longer exists?
Or the state legislature has directed the Department of Health and Welfare, that typically receives those federal funds, to subgrant differently. So now, instead of like the adolescent pregnancy prevention program, instead of those funds going to the Department of Health and Welfare, they're going to go to the State Department of Education.
Is it who is it that applies for these grants?
Typically the Department of Health and Welfare, but then they have to receive spending authority from both the governor's office and the legislature.
Okay. And so in this case, that was transferred, and so now the education department will be applying for these funds, is that right?
Yes, that's my understanding.
Okay.
Do you have a different understanding? Okay.
So on these various programs here, how do you, I'm sure some of these programs must be relatively new. You haven't had all of these programs, I assume, for decades. They come and they go over time, is that right?
That's correct for some of them. Some of them, like communicable disease investigation, that's been a core public health function since public health was created. So we've always had that. Some of the new public health preparedness that began in 2002, following the anthrax attacks that happened shortly after September 11th in 2001. And so we received a pretty sizable influx of funding to stand up those programs, and those have scaled back pretty significantly in the 20 plus years since they started. But that was sort of the what prompted the beginning of that program. Suicide prevention is new. Our board made a decision probably about 4 years ago. We had been looking at the data around suicide in our region and sharing that with our board for a long time. And frankly, I was pretty weary of sharing the data and doing nothing about it. So we requested from our board that they fund a position sort of as seed money to start some suicide prevention work in our communities. And that actually worked out very well, because now we do have subgrants from the state to fund that position and that work.
Is that work 100% funded by subgrants?
That one,
Not
100%.
And so is that pretty much like you've just described, is that pretty much the process, how a new program would come to be? You do some research. I mean, this is the way I'm understanding it. You do some research in your organization. You bring that to your board, and maybe with a recommendation to somehow take on this program, and then they vote whether or not to add a program. Is that right?
So that's one way it may happen.
Mm-hmm.
It may also happen that the State Department of Health and Welfare applies for funding to address a specific issue, for example, heart disease or injury prevention. If they are successful in obtaining those funds from a federal level, they don't have the bandwidth to provide services at a local level, so then they will approach the public health districts collectively. Sometimes they're able to fund all 7 of us. Sometimes they do pilot projects in 1 or 2 or maybe 3 districts. And then we make a decision about whether or not we're going to take that work on, whether or not it fits. A lot of the kind of health promotion programs or clinical programs, they have been pretty consistent for some time. If something is really radically different, then we will come to our board and make that request to approve or not approve. One example is we're partnering with Idaho State University on a program called the Area Health Education Center. And that is a program where we work with students across health disciplines at ISU to help them have exposure to rural health care and community-based care and public health, because we are a healthcare provider shortage area in the entire state of Idaho, but ours is really acute in our rural areas. And so by working with these students and giving them exposure and opportunity to learn about rural health and what that looks like, we're hoping that we can kind of grow our own, and that students will stay here, whether it's nurses or PAs, physical therapists, occupational therapists, counselors, etc.
And that's a new program?
New this year, yes.
And
it had been at ISU, but we had been affiliated with the University of Washington. The ISU program had been affiliated with the University of Washington. ISU wanted to take on the University of Washington role and facilitate the area health education centers around the state and build that up so that there was one at each university throughout the state. But in order to do that, they could no longer run the Southeastern Idaho Health Education Center. So they approached us last March to see if we would be willing to take that role on. And so we took the proposal to the board, and they voted to approve us moving forward with that new project.
And so that increased your budget?
It did.
How much?
Oh gosh, I think that program is about
subgrant is $108,000 for the main piece, and then there's a secondary subgrant that's $23,000.
But that budget covers all of those costs.
So it's fully funded from, not from the counties, but
Correct.
from some grant. Okay. I was looking through some other data that I guess presented with the board. And one of the things I had a question about was your full-time employees.
Okay.
So I understand in fiscal year 20, if I'm reading this correctly, you had about 71 full-time employees back in fiscal year 20.
That's probably
And
correct.
Your proposal for fiscal year 24 is approximately 91 full-time employees, which is between a quarter and a third of an increase. Can you talk a little bit to why the significant increase in full-time employees?
Yeah, I'll start, and you're welcome to jump in if you'd like. So, thank you. So, are you looking at this budget to
Yes.
actual?
Mhm.
Okay. So, the blue line being what's budgeted, the red being actual. So, when COVID hit, we got a substantial influx of federal dollars. In order to respond to that, we only had 2 epidemiologists at the time who were doing disease investigation. I think we had like 6.5 nurses. That wasn't adequate to be able to respond to the pandemic, and so with those federal dollars, we pretty rapidly hired people to assist with disease investigation, contact tracing, our testing site, once vaccine became available with mass vaccination sites, going to homebound people to provide vaccinations if they wanted the vaccine and weren't able to get to a vaccination site. So that was a big chunk of that increase. We also had situations where, for example, in Ken's shop, he had been incredibly lean, and the septic world just exploded, and his team could not get it done. And so we went to the board and requested an additional FTE for his shop to help with that. And that was something we had delayed for quite some time because we were concerned when COVID hit that how the bottom would sort of fall out of the construction market. So we had been planning to ask for that FTE increase, and we tabled that because we were worried that we would then just have to lay that person
That one
off.
individual.
Yeah. But that's an example of why our FTEs went up. We had to add nursing staff so that we could handle the vaccination demand for COVID vaccine and that sort of thing. So, other thoughts?
I just would like to add since that pinnacle point, it has been coming down. The reason why it's
What has been coming down?
The FTE has been coming down because those main COVID positions have gone away. The little bit of a swing back up is from a couple of things. One, the opioid program and a couple of positions associated with that, like the counselor position she talked about. And then also those 4 positions that are part of the new infrastructure funding that will get July 1.
So most of this increase, if I'm understanding what you're saying correctly, it was to respond to the pandemic.
Most of it, yeah.
Mm-hmm.
But like Tyler said, not only do we have the counselor position with the opioid funds, but we also have a care coordinator position, because one of the things that we have found is that people who are using opioids not for medical purposes have a really hard time navigating other services that they need. And so with the opioid funds, we have created a care coordinator position that's helping get people connected to the resources in the community that they need, whether it's employment, housing, food assistance.
What fiscal year was the height of the pandemic response?
Well, probably fiscal year 21 and 22.
Okay.
And as you can see, I mean, this is a long-term trend. We had been on a very steady downward trend of FTEs. We made decisions for many years where if someone were to retire or leave the organization, we would really rigorously evaluate, do we need to fill that position, or are there other people that can take it on? Tyler is a really good example. When he started with us, he was over our HR role and function, and we had a fiscal officer. But Tyler has a background in accounting and finance. He has a master's in business administration. And so when our fiscal officer started talking about retiring, we made the decision to combine those positions into one person. So now he oversights human resources and all of the finances as well. So that's one example of us taking a look at our situation and deciding, can people take more on? I think Ken can probably attest to the fact that we did that to a point of it almost being unmanageable, that people were working so hard and so much that we were at real risk of people completely burning out because there was no break. And so that kind of leveled off. You can see in probably like started to level off in fiscal year 13 till about fiscal year 20, and then we had that sharp increase due to COVID, and now it's coming back down again and will be leveling off.
But it really, to me, it doesn't look like it really is coming down. I mean, you had 90, if you average 21 and 22, that's about 90 people, and we're at 91. So we had this significant increase from COVID, which resulted in, looks like double digits increase in personnel, and I see the number of personnel is still the same, even though the COVID pandemic, I think, is over, right?
Yeah, so we have the opioid positions, we have the new public health infrastructure positions that are included in this. We have Parents as Teachers, which is a program we've had for about 8 years, but there have been new funding sources added to support that. So we used to have like 3 Parents as Teacher staff, now we have 4. I mean, so it's small changes, but they add up. There was another one, I'm sorry, I'm drawing a blank.
Okay. I also wanted to look at the budget, the total budget for Bannock County. And so I was looking at I went back to our budget for a little bit here, because certainly with the head count that increased, I expected a significant increase in how much we were contributing as a county over the pandemic years. When I look at the fiscal year 21 approved budget, we were at about $590,000, and now we're at 1.1 million.
So that's because of House Bill 316. Mm-hmm. So what House Bill 316 did was, and it was very complicated. So let me see if I can explain this in a way that it's like reasonable. So the intent of House Bill 316 was to eliminate the medical indigency programs at the county level and the catastrophic health fund at the state level. Then remove the state general fund appropriation from the public health districts and require the counties to make up that difference from the funding level of fiscal year 2021. Okay? With the idea, and the Idaho Association of Counties supported this bill because the alternatives were not great. The alternatives that the counties were being faced with were things like cut in revenue sharing. So Idaho Association of Counties took a look at projections of eliminating the medical indigency fund and then making up this state aid piece to the public health districts. Most counties were projected to come out ahead with that shift, okay? So when we go back to some of these pages, like when we talk about original state aid and original county aid, essentially what House Bill 316 did was double the county's contribution to the public health districts.
All the counties.
Yes. Yeah. So you're correct in that year that you looked at, the contribution was about 500 and some. But because of House Bill 316 and having to make up that piece of state general fund aid from fiscal year 21, which is $1,142,300, that adds on to the county contribution to the public health district above what the original statutorily required aid to the public health districts is. Does that make sense?
And did Bannock County, you said most counties projected to come out ahead. Did the counties come out ahead?
I don't know. I've been trying to get that information from the Idaho Association of Counties. Our only county that was, we had 2 counties that were projected to come out in the red, and that was Franklin County and I believe Power County. The rest of our counties were projected to come out in the black. And I believe at IAB, Seth is going to be there, and he should have those numbers at that meeting.
I think we did. I think, because we called Christy and asked her about that, and I think in our initial thing, we did come out ahead. Still not very fun.
I know, and we were not, I mean, the public health districts themselves were not happy about this. We have tried so hard to be very cognizant of the limitations that our counties have. And if you look at our history of what we ask of the counties, most years we ask for level funding. It is very rare that we ask for an increase from our counties.
Do you ever ask for a decrease?
We never have, but because of changes in those 2 components of the formula, sometimes there is a decrease. If you look at that, of our 8 counties, 3 have an increase this year, proposed increase. It's Bannock, Bear Lake, and Bingham. The rest have a decrease.
Mm-hmm. The reason I ask that is because everyone that comes in front of us, our departments in the county, we're asking them to examine their processes, examine their systems that they have in place, look for efficiencies, and try to find ways to reduce costs. And that is driven by the stress that we're placing on the taxpayer, which certainly is a health issue.
Yeah, we understand that, and we're very respectful of that. And, we have not asked for a cut in the 27 years I've worked for the public health district. If our board directed us to do that, then we would do that.
That's all I got.
And you mentioned right there, I have, I have problems, and part of it is the setup of the board. But I don't believe that people should be on that board that are not elected officials, because they don't have this. You're not going to Butte County and presenting to the board member. You're going to Butte County and presenting to the commissioners. And the board members over there voting separate from the elected officials. And that bothers me. The other part about it is that we have 48% of the population on one vote. And I would like to go to the legislature and get this settled. I mean, if you look at legislative districts and stuff like that, they get voting according to population. And so these are just some things that bother me. And I've voiced before.
And those are things that are like completely out of my control.
They are. But that's why when I'm the only opposing vote, it's not a personal deal. And I hope that none of you feel that. But it's, like I said the other day, we haven't even talked about raises for our people. And you are our people through the way it's set up. But with the opposite, our different budget years, it's confusing and frustrating.
Yeah, I have a lot of empathy for you on that fiscal year thing, because like right now we deal with 27 different fiscal years with our subgrants. And that's really challenging, because I'm having to set our budget now. I have no idea what the dollar amount is going to be for contracts that start on the 1st of January. So we have to make our best educated guess and hope that we're correct, and if it comes in low, then we figure things out and make it work. If it comes in more, then we make that adjustment as well. So we get it.
Well, I got an email from Idaho Power this week, says expect a 10% increase June 1st.
Yeah,
I mean,
we got that too.
look at our budgets. That's a pretty substantial increase in every department that we have.
Yeah.
So, anyway,
Yeah, and the cost of fuel being up
Oh.
is cost of propane. Our Malad office has propane heat, and that cost, even though we've filled that tank fewer times this year, the cost has been higher because the product is more expensive. Yeah, but believe me, we regularly, I think, look at how can we do things and do them as cleanly as possible,
well, thank you.
because that's important to us too.
Further questions?
Nope, thank you, appreciate you.
Comments?
Okay.
All
All
right.
right, thank you for your time.
Thank you.
Thank you.
With that being
Rest of your
said,
day.
we are adjourned. Thank you very much.